Well, I hope that you enjoyed the Langford Hotel segment of A Vegas Wedding by the Orlando Theater Project. And as you can tell by Joseph, we have our next special guest, who is Dr. Christopher Prevel. He is a plastic surgeon, and we are going to chat about plastic surgery in men.
Not that we need it.
And how it's so prominent in men nowadays.
Not that we need it.
Okay, glad to meet you, Dr. Prevel. Thank you for coming on the show.
Thank you for inviting me to the show.
Very good. So this is a love and romance and relationship program, and so we're going to talk about why are all of these men who are now the baby boomers getting all of this plastic surgery done? And tell us what are the most common procedures? Is it tummy tucks? Or
Hello.
Is it derriere lifts? What is it?
The most common procedure, Michelle,
Derriere.
is actually liposuction, also known as lipoplasty. And it's very common in men between the ages of 35 and 50. Individuals who have sort of the midriff bulge.
Ah, the love handles.
Know nothing about that, folks.
Love
I have
handles.
no idea what this man is talking about.
You have love handles.
One
you
of the,
have love...
I got love tires is what I have.
One of the things that, that I like to counsel folks about is that liposuction is not a cure if you're for an overweight condition.
Gotcha.
That it really is for the treatment of diet-resistant fat.
Oh, okay.
And that one should really be within 10 to 15% of their ideal body weight.
Gotcha.
Any more than that, folks really won't be happy with the outcome.
Or they just need to go to the gym and work
Yes.
out for some people.
Absolutely.
Is it because the skin is so stretched out that if you're above that 15%, that when you take the fat out, the look is not as aesthetic as they would like it to be?
Yes, that's one of the components. You, when you are within 10 to 50% of your ideal body weight, the result afterward is much improved because the skin and the dermis of the skin have contracted and the result is a bit better. In addition, if you're down to, say you were 50% above your ideal body weight, you lose the weight, you may have to also have an abdominoplasty or have skin removed beyond just removing the fat.
I see.
So, for instance, if a guy comes in and says he wants to get liposuction done, and do most of them have this vision of getting like a six-pack stomach again or something?
Yes.
Or what?
No, actually,
wash your clothes.
most of the folks that I see are pretty realistic.
Yeah.
They really just want to look better in clothes, and because of the great Florida lifestyle, they're outside in shorts and T-shirts. They want to have an improved improved body image.
So why do you think they really want to get this done? Do you think it's because like these baby boomer guys want to start getting attractive to the young chicks out there, or what is the real reason? What's the real reason?
I should say chicks.
I'm sure that that's a percentage. A lot of the folks who I see, if that's one of their motivations, don't tell me
They
that.
don't say that.
No, they don't.
No.
But
They don't say, Doctor, I'm a loser. I want you to make me a winner.
No. The motivation, a lot of folks are very happily married men, and they just want to improve their body image.
That's great.
And some individuals are in sales or in front of the public, and they want to improve their appearance because there are always folks younger who are behind them. Competition.
Sure.
And they want to make sure that they maintain their edge.
Sure. So what other type of surgery are men getting nowadays besides liposuction?
Another common procedure are blepharoplasties, which is a medical word for eyelid surgery. That can also involve the brows. Elevation of the brows as we grow older, they tend to droop or descend. In addition, a rhinoplasty, procedures to the nose, as well as facelift procedures.
Well, we have a great chart here that kind of talks about the 1998 top 5 male cosmetic surgery procedures. So here we go.
There were 99,000 procedures performed that year.
Yes.
That's a lot. And the number one is what?
The number one is liposuction, also known as lipoplasty. One of the points I'd like to make about this is a chart that's prepared by the American Society of Plastic Surgeons. It says plastic and reconstructive, but they shorten the name of the society.
Correct.
97% of all board-certified plastic surgeons are members, and they're certified by the American Board of Plastic Surgery. Anytime any individual wants to proceed with cosmetic plastic surgery, they really need to have someone who's board certified.
Correct. Because you want the professionals. I mean,
Absolutely.
And there's a lot of people out there that are not board certified that are performing these procedures?
Yes, there are.
Oh, see, and that's where major problems happen because...
Absolutely.
Well, now how does someone go about finding a wonderful plastic surgeon?
One of the best ways is to go on the web. plasticsurgery.org.
Okay.
That is the website for the society, the American Society of Plastic Surgeons. You would put in you'd put in, of course, Florida, if you're in Florida. You'd put in your city, and then it'll list the members, and those are all individuals who are certified by the American Board of Plastic Surgery.
Now, you are certified by
Yes,
the
I am.
board,
Yes, I am.
and you were also featured on the cover. Let's take a look at this. He was also featured on the cover of Me magazine.
That's right.
And what issue is this?
This is the June-July issue.
Okay.
And what was the article about?
The article was about the institute that I've created in Metro West and the services that I offer treating patients there for a variety of cosmetic procedures and reconstructive as well.
Wonderful.
Okay, so in your opinion, so all of these baby boomer men are getting all of this cosmetic surgery done, and all these guys are looking great. Do you personally think that it might affect their marriage? Maybe they're going through like a midlife crisis. This guy starts to look really, really good now, and then maybe all the young chickies are paying attention to him.
And the wife is feeling a little insecure.
And the wife might be a little bit overweight by then because they both got overweight together.
You can tell folks that we
and
read
she
these
had
novels.
Children.
This is like a novel thing. We're already developing this scheme, you know, because we're going to write a book about this.
Wait, you know what? I have a question though too. Is that how come when people get married, they both gain weight? But the women are the one who had to have all the children, and the men never had the children, and yet they gain just as much weight, and they get this middle going on.
What middle?
Why?
Well, actually, what I can maybe turn around the question for a second. In your hands are one of the charts of the female plastic surgery procedures.
Thank
Okay,
you.
let's take a look.
And as I recall, I think they're about 4 times as great, if I'm not mistaken.
Thank you. Thank you very much.
Well, no, actually, I mean, my question is that how come guys do not have children and they gain
still
just
gain
as
the
much
weight?
weight as women?
Because you guys cook
I
too
think
much.
Here we go.
because I was
women's.
wrong. There are 900,000 procedures, so about, I guess, 10 times
10
as many.
times as many.
10 times as many.
So what's number one for women again?
And number 1 for women is still liposuction.
Now, a question I had to you before we ended up going on the air
Yes.
the question was about if you do like this liposuction, this fat placement and so forth, right?
Yes.
Why cannot they take, say, fat from a woman's derriere and like insert it like in her breast?
I understand. That's a very good question, and in fact, it's a very common question.
Is it a different type of fatty?
Actually,
I know it's not
no.
that simple, but
No. Actually, the reason is when you transfer fat that's been removed by liposuction, the tissue has no blood supply.
Has been destroyed.
Right, and it has to regrow blood supply. Not all of that fat will regrow blood supply, and what fat doesn't becomes calcified.
Oh, so you get the
Calcifications.
Yes.
And so if you inject fat into the breast and you have calcifications, then it can be confused for breast cancer when a woman has her yearly mammogram.
Of course.
And so you should never inject fat into the breast because it will confuse a mammogram in the future, and then a woman has no idea, nor the doctors who are treating her, whether she has breast cancer or it's the fat that has necrossed or that has died.
That's
okay,
very
so
interesting.
there was over 130,000 women who got breast augmentations. That's
Yes.
that's where you add breasts, right?
That's where you add implants.
Add implants.
Yes.
Okay.
Yes.
And why do you think is the reason why women are getting that done?
Society.
Absolutely. I really,
Society.
Joseph,
Is it
I agree with you
America?
100%.
Is it mostly in America that they
Well,
get this done?
that's an interesting contrast because I've recently had the opportunity to review some British publications.
Okay.
The British Journal, the British version of Cosmo, as well as a women's magazine called She.
Okay, well, let's talk
Okay.
about that when we come back. We're going to find out the statistics of what goes on beyond America. Stay tuned.
If you're enjoying the Michelle Valentine Show, you will love her new travel TV show, Love, Eat, Travel. Follow Michelle Valentine as she travels the world, showcasing the most beautiful destinations, unique adventures, romantic things to do, delicious foods, and more. Visit www.loveeattravel.tv for more information about an upcoming TV show.
Hi, this is Michelle Valentine, and I would love if you followed me on Facebook, Instagram, Pinterest, Twitter, YouTube, and LinkedIn. Be sure to visit my website, michellevalentine.tv, for more information, read thousands of interesting blog posts, watch videos, enter sweepstakes, and more. Also, be sure to join my email list to receive my free weekly e-newsletter.
Are you wondering where all the quality singles are? Singles that are attractive, educated, and financially secure? Hello, I'm Michelle Valentine, and I've helped thousands of singles live a happier life, and I can help you too. Clients and members include millionaires, models, doctors, lawyers, and teachers. So call us for your complimentary consultation.